irritation of the mesenterium that surrounds the gallbladder, and after that you have pains. The same is about Greffe. What about Greffe symptom? Greffe sign.
Apa tu?
Greffe
Gagisnemosi.
ada tanda edge of the sternocleidomastoid.
Between its
Sternocleidomastoid.
what do we have to ask the patient?
Pusing.
Yeah, to
To
turn his head up. Yeah, and we can find easily these two parts of merciless. While palpating, why does occur the pain? Because it's reflectory. Yeah, the phrenicus nerve goes here, and after that it goes down to the gallbladder. So that is nervical connection between these two. In what region can pain irradiate in the acute cholecystitis?
region, right shoulder,
The right region, right shoulder, right jaw,
Angle of scapula at the
and
back.
right angle of right scapula. What else? Or down. You should every time remember that gallbladder is no fixed organ, first of all, and its anatomical position is very different. It could be even in that region here, so pain can irradiate not even here, but form even here. I have the patient with gallbladder in the pubic region that lays on the ilium. So, what is Courvoisier symptom? Courvoisier symptom. No, Courvoisier.
Oh, yang korang apa weh?
Did you find?
no,
So once more, Courvoisier symptom is enlarged, unpainful, less enlarged, well palpable gallbladder in combination with jaundice that is due to tumor of the head, cancer of the head of pancreas, and it attacks on the mechanical jaundice. That is a sign, very specific sign for the tumor of the head of pancreas. Once more, enlarged, well palpable, painless gallbladder with combination with jaundice. Which type of jaundice? Obstructive, and it goes from day to day. It's not sudden. Jaundice is growing from the day to day, being more increased and significant. What else about gallbladder? What is it?
expansion,
In which part?
gallbladder,
Show, please.
and then patient to deep expansion, and then feel tenderness.
And when pain appear?
When
On the peak of the inspiration. What else?
About satu lagi Zakarin
7 point.
have 7 point at the back.
Please show.
Kat belakang
First at the tak sini je. First at the region of the gallbladder.
First at the region of gallbladder, and then second at the back.
Sebab dia bukan 3 lambak.
And second dekat epigastrium.
Epigastrium,
Epigastrium atas ni.
Atau tu.
Ni epigastrium.
Yang ketiga pancreatobiliary.
Yeah, that is in the connection between gallbladder and
Pancreas.
pancreas. That's common bile duct.
tiga. Lepas tu
Apa ada ni at the shoulder.
shoulder, and then here
Kat phrenic. At the phrenius.
By the way, the same symptom could be in acute pancreatitis, but on the left side. But it's more rare. Most typical is the left side that is connected with the pathology of the gallbladder. What about provokant factors, about triggers that can cause the acute attack of cholecystitis? Provoking factors.
Utunya.
Overeating, eating fatty meals,
Cholesterol.
yeah, some dried food, fatty foods, and so on. What else? Physical exercise, of course. Gallbladder is well movable and it could be surrounded in case of forming stools. If patient has gallstones, what can provoke exercise?
A spasm of the cystic duct due to the obstruction of
Some spastic process, yeah. For example, due to stress or motions. You have
Emotion.
rapid spasm of sphincters, and after that, if at this moment stone in the cyst or the head of the
by
gallbladder,
cannot
it could be
flow.
fixed and causes obstructive jaundice. In most cases, some trembling movements, or for example, in car in transport, when stones are movable, yeah. And then you go to what else? Due to parasites.
Parasite.
You have it from class.
Parasite.
Which parasites
Parasites.
are associated with impairment of bile duct?
Jaundice the illness.
Monocytosis.
One.
Lambda.
So it causes chlorhexidase. Yeah. What else? But I think in English it's chlorhexidase. Better to say. Yeah. Let's say the second one.
Tak sure. Dicrocelium is it Dicrocelium dendriticum? Is it normally
It's
in
not
the
so common, but okay.
Fasciola hepatica?
Yeah, it's most common.
Fasciole hepatica.
It causes fasciitis. Yeah. What else?
Cystoscopy.
Schistosoma, yeah. And
By this Google. Leptosporidium?
what about epistochlorosis?
Chinese liver fat.
Yeah.
Yeah.
And Gergelam, we have discussed. That is. So other one are very rare, and you have discussed. Once more.
Okay, so it will
Let us check once more. Clonarchus,
Chronosis.
Clonarchus, Gergelam, Epistochlorosis,
Fasciole hepatica.
Fasciola, and Schistosoma.
Schistosoma for
That is. Okay, in case if you are discussing positive nature of impairment of obstructive jaundice, you have to make analysis for the levels of antibodies to these parasites, IgM, IgG. It depends on the duration of parasitosis. If you a few days, also 3 weeks after invasion, that is IgM. If you some months or years passed after invasion, the IgG. How many weeks do organism need to form IgG, immunoglobulins G class? More to 2 weeks. After 2 to 4 weeks, immunoglobulins M are forming, and after that appears immunoglobulin G class. They are less specific that IgM. You have acute process, you should discuss IgM physiology. And to find out all the process. Of course, not only in blood, also in the stools, because we have eggs and some particles of parasite or antibodies in the stools too, but it's rare analysis. What else? What about nausea and vomiting in acute cholecystitis?
Nausea, vomiting. Yes.
So it's one of the most common symptoms.
Dyspeptic.
Does it bring relief?
Bring relief.
Oh, pegal bangun tu.
Is it any relief after vomiting in the acute cholecystitis?
No, it will feel pain.
Dia tu.
Ada pernah cerita.
No, the same thing like in pancreatitis. There is vomiting without any relief, and we have repeating vomiting. What very interesting and important sign? What taste the patient describes?
Metallic and bitter.
Metallic and bitter taste. It could be without any vomiting, only during nausea, some bitter taste, some metallic taste in the mouth, and vomitive mass also is bitter. Why so?
The bile.
Due to the presence of bile. Okay. What type of jaundice can occur? Obstructive, yeah. Let us repeat signs, laboratory signs of obstructive jaundice. Who can answer? Laboratory three signs of obstructive joints.
Hereditary signs of obstructive joints.
Kain kan.
No color.
So you should
Colourless.
start with blood.
Blood.
Mhm.
The high concentration of the conjugated blood.
Full blood count.
Red blood cells.
Leukocytosis due to inflammatory process cause cholecystitis is inflammation. Okay. Increased TSR. Yeah. Okay, that's all about this. Yeah. What about biochemistry? We'll start.
Bukan bilirubin.
Kain ulang balik.
Increased total bilirubin. What about fractions?
Direct ke indirect lagi tinggi. Indirect yang lagi tinggi in the blood.
The conjugated tinggi direct ke direct?
Indirect.
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 Conjugated.
Kan?
What is the relation between fractions? Who knows?
Direct.
Tapi liver normal.
Liver normal, so conjugated more direct.
Any ideas?
Conjugated from
So both fractions are increased. Yeah. But little more higher is direct bilirubin because liver function is not impaired. Normal. Okay. What about stools?
Colourless.
Colorless.
Into urine?
Urine light yellow.
Dark yellow. Dark yellow. Why so?
Because of
ada urubin.
You know.
euro. The presence of there is no euro.
Ada. Dia ada urubin.
Urubin bagi mana?
Urubin dekat dalam.
The presence of the urobilin.
Urobilin.
I want you to say it by yourself.
The presence of urobilin.
Presence?
Yes.
Where?
In the urine.
And why stool is discolored?
Because there is no excretion of sterols.
That is blockage. Blockage of urine, bile excretion, and after that, which pigment is absent in stools?
Stecobilin.
What else? Anything else to add?
Anti-gastric.
Absent of both stecobilin and urobin tu. Kan? Tak tahu. Absent.
Yeah, that's perfect. Which drugs, which substances may resolve the pain in the acute attack?
Drugs yang boleh resolve.
Napomil.
Which drugs are the first aid in the acute cholecystitis?
Tak, nama dia pelik tau.
Macam dia kata from aku.
Spasmolytics. Spasmolytics. Yeah, to make relaxation of sphincter and making a better outflow of the bile. And even in case if a stone in the gallbladder is fixed, relaxation of sphincters can pull the stone out. What else? What about analgesics? Of course they relieve the pain, but what type of analgesic is contraindicated in the case of spasm? Narcotic. Narcotics, analgesics, in certain it's morphine, is contraindicated because it causes the spasms of body sphincter. And you provoke, you increase the spasms of sphincters and provoking the blockage of outflow of bile. Or press right down, that is morphine and narcotic analgesics are contraindicated in the case of acute cholecystitis. Or if you think about cholecystitis, you shouldn't give the patient narcotic analgesics. What about digestion impairment in case of chronic cholecystitis? Вам, наверное, обедать пора.
Ну, ничего страшного.
Вы видите, мы с ней
Да.
просто болтаем. So, say thank you for patient.
Спасибо большое.
Спасибо. Мы с ней в коридоре. Let's go in the hall.
До свидания. Спасибо.
Scary kau gini.
Iya tu. Kalau tak salin apa pun.
So far,
Out dia.
please take a seat closer to you. So, answering about digestion impairment in the chronic studies, you should remember. Evolve. You should remember what are the functions of bile for digestion.
Bye. Tu digest fat, lipid.
What are the functions of bile for digestion?
To break down the fat. No.
Break down the fats is the role of enzymes.
Emulsify.
Yeah. And to make a soluble form of fatty soluble vitamins. So after that you have impairment of bile outflow, for example in case of obstructive jaundice, or insufficient excretion of the bile in case of lazy gallbladders and conditioning clinical. You have impairment of digestion, absorption of fatty soluble vitamins. What are they? What fatty?
Adik. A-D-E-K.
And
E-K.
K. I want you to briefly discuss the symptom of deficiency of every vitamin. Let us start with K. Blood disorders, that is procoagulation factor that is needed for synthesis of serum coagulative factors. Okay, bleeding disorders. Another one, D. Bone formation and metabolism of calcium. So after deficiency we'll have what? Osteoporosis and increased risk of fractures. Okay, what about E? It is difficult to describe all the functions of vitamin B, but certainly you can say that is antioxidative functions, and you have general symptoms of malnutrition. Okay, A. What are symptoms of vitamin A deficiency?
Blur vision. No.
Not blur, but impaired night vision.
Not too.
And I told you to make a little table about types of jaundice. Is it the beginning of this table or not?
Is that the beginning of what?
But not sure. So I think
Okay, you have 15 minutes to make the table and copy it between you. You can make only the one, but after that I want you to this table to migrate in your books. Okay? So 15 minutes. We'll meet in 2:30.
sebab ni
Bukan, kalau saya dengar balik dia kata